Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, the Frankie Smith Funeral Home, and Lancaster Fairfield Community Action Recycling and Litter Prevention.
Hello and welcome to Fairfield Today. I'm Kathy Bittler. We do want to start with Dr. Jose Norberto, the cardiothoracic surgeon. That's easy for most people to say. It's great to see you, Dr. Norberto. Thanks for taking time to join us.
Thank you, Kathy, for inviting, and for me it's a pleasure to be here.
Well, I know firsthand the great work that Dr. Norberto does here at Fairfield Medical Center. Did a great job taking care of my husband a few years back, and we are just so pleased to have you as part of our community and part of Fairfield Medical Center.
Well, thank you for the opportunity to the hospital that gave me the opportunity to start a program here back almost 12 years ago now.
Tell us a little bit about your background. You're from the Dominican Republic.
Yes, I am from the Dominican Republic, and I came to the United States in 1990 to do my training in general surgery first, followed by cardiothoracic surgery. So it took probably 10 years of training before I started in practice.
And then how long have you been here at Fairfield Medical?
Since October 2001.
Okay, and as you said, you started the program here. You really came here and advanced what happens in cardiac care here at Fairfield Medical Center.
Yes, when I was hired back in 2001, we were not doing cardiac surgery here. Right. And actually they were doing only diagnostic cath. What that means is that if somebody got a cath and showed that needed surgery, needed to go to Columbus. In fact, if he needed a stent, needed to go to Columbus. Mm-hmm. So in order to put a stent, they needed to have a cardiac surgery program in place. So that's how they brought me here from Ohio State University. Since then, we have performed more than 2,500 hearts now. And it's with great pleasure that I have to announce to the community that, number one, we monitor those cases very closely. Mm-hmm. We just don't offer the operation. We have to make sure that our product, that our program is performing at the level of the other program or better in the United States. And so far so good. We have the way that we monitor is with what is called the Society of Thoracic Surgery database. What that means is that we send our data to a national bank, a national database, and some statistician, they do the analysis and they tell us where we are in comparison with the others, and we make adjustments. So we have a continuous surveillance of how we perform.
And how do we perform?
Very good. I am very pleased. We traditionally are below the national average in terms of mortality and morbidity, so I'm very pleased.
That's terrific, and it really is due to, in great part, to the work that you do here. We've got a new offering, some innovative surgery that you're doing, and I had the great opportunity to hear a little bit about this a few months ago, and I'm just amazed. We're talking in terms of minimally invasive heart surgery, right? Yes.
Well, the thing is that the reality is that the patients want less and less invasive approaches, meaning the incisions, they don't want incisions actually. If we could come up with some procedure without incision, that would be number one.
I think they did that on Star Trek years ago.
Yeah. But we are not there yet, but we are going from an incision that is so big like this to probably a 2 inches incision for the replacement of the aortic valve as well as the mitral valve. So that we're offering that here, and we started that actually a few months ago, and we have already performed a few cases, and we're very pleased because it's safe. It's a safe procedure. We haven't sacrificed safety with this approach.
And that, of course, is paramount.
Yes.
I guess you would say to a patient, would you rather to have a 6 or an 8 inch incision, or would you rather live through the surgery? And that's a no-brainer. But I would think beyond safety and beyond patient preference for these smaller incisions, that there are other things to consider in terms of healing time and
Yeah.
things along those lines?
Well, the reality is that the bigger an incision is, that means bigger trauma to the body. That means the body has to use more energy to heal. And the way that the patients feel that is they feel very tired when they have to heal too much, because that energy that is supposed to carry them through the day and to do activities, the body is using it to heal. So the smaller the incision, the less energy they have to use to heal those incisions. And in theory, patients go back to work faster and the amount of pain is less.
Which is always good.
Always good,
good
always
for the
good.
for the patient. So this incision you're saying is just a couple of inches?
Couple inches, 2.5 in that range. And it's basically in the upper part of the sternum here, or sometimes here in the side, depending on what valve are we approaching.
Oh, okay, so let me picture this then. If we're doing the one over here, then you're going pretty much all the way through the body to get to the valve?
No, the thing is that one of the valve, the mitral valve, is located very posterior in the back. It's the most posterior valve that we have. So actually going through the front is kind of more difficult.
Oh.
So this position here in the side give you a straight shot at that. It's more distance, but it's a straight shot. So actually I found it easier to go through the side to do the mitral valve than through the front. Now, not everybody meet the criteria to undergo this procedure. There are specific patients that we can't do it that way and we have to do the regular approach. Other patients, yes, we can do it like that. That's why we have to evaluate the patient first.
And what kinds of conditions might the patient have that would make this surgery not good for them, make them not a good candidate?
If we have to do a combined valve plus bypass surgery, then we have to go through the front,
Sure.
the regular approach. If we don't have to do that, and depending on the body size and things like that, we can go through a small incision.
What kind of training do you receive for this? Is this something special training that you had to get after your regular?
Actually, that's a good question, because when I was at OSU for my regular cardiothoracic training, we were trained on this. What happened is that at that time, in the when I started my training at OSU in 1997, the way that we were doing, the technology was not there yet. So yes, it was done, but it was a lot of work. There was not a lot of efficiency with that. So when I finished the training, even though I was trained, I decided that I didn't feel that was safe to do at that time. So I decided to kind of drop that. But recently, a great surgeon from Miami, Dr. Joseph Lamela, has really made a lot of improvement in the technique and have made it very safe. So I went and trained there with him again, and I went to Mount Sinai in Miami and also to Toledo. And I went by myself first, and then we took the crew, we took my team from here to Toledo to watch a few cases there. So basically I came up with that training. I didn't use it for a while. Then I went back and kind of retrain or have a refresh course to do it.
And you mentioned your team. How large is your team?
Well, we are like around 12 people in my team. I might have left one or two, but basically we didn't take the whole team. We took a sample of the team, and that particular sample is going to train the others with that.
A train the trainer kind of.
Yeah.
That's a great idea. Now, with this whole team, because as I said earlier, I didn't want to see you operate on my husband. I just wanted you to do a good job, so I don't know. But is it normal that the whole team would be involved in one surgery? I mean, how many folks are?
Well, usually there's a team that include anesthesiologists, perfusionists, a first assistant, a second assistant, the nurse that is, or the tech that is passing the instrument, and the circulator. So it's probably around 7 people in the room under the directorship of the surgeon.
Okay. So what types of surgeries are you doing yourself now here at Fairfield Medical Center?
Well, our team is performing basically the whole variety of cardiac surgery procedures, from open heart, regular coronary bypass grafting, valve surgery, as well as what is called off-pump bypass, which means that the patient is not placed in the bypass machine. We perform the operation while the heart is beating. So basically, we perform the whole variety of cardiac procedures. The only thing that we are not performing here at Fairfield Medical Center, and it's not because of lack of training, because it's actually one of my sub-specialties is heart transplantation. We are not doing that because you need more manpower to do that kind of work. That's the only thing that we are not performing.
So we started this by saying that you came here and started the program, and when you came in 2001, we were really just doing diagnostic catheterization. What I'm hearing you say now is we can do everything here up to heart transplant.
Yeah, except heart transplant, yes.
So why go anywhere else?
Well, and that's a good question because we did some research here, and there are people here in Lancaster that do not know that we do open heart surgery. And I think that it's very hard for a patient, the patient family. Yes, Columbus is close, but it's not close enough, especially for an old lady that has to go to Columbus to see a beloved one. Yes, there are cases that indeed we send to Columbus, but they are very few.
I've seen some billboards around town, and I think that's probably part of this idea of helping the community understand that this service is available here. But tell me a little bit about that billboard campaign.
Well, yes, I was surprised the first time that I saw the billboard. I was not expecting that, and I was driving to my house, and I was actually very tired after the procedure, and from the corner of my eye, I see something that resembles me. So I was driving, I looked, well, that looked like me, and actually it's me, So I think that what the hospital is doing is increase the awareness that indeed we have a very solid program. And I want to be very clear with the community. Cardiac surgery is safe because we do a lot of that, but it's definitely a major procedure, and there will be complications, but the complications and the death that we'll have are gonna be basically comparable with any other program. So, I want to make sure that people know that because it's not pulling toenails. This is a major surgery. It takes a lot of dedication from everybody. But I am one of those people professional that I do not offer anything that I can offer to my own family. So if I can offer to my dad or my mom, I will definitely not offer to anybody.
Well, again, you've performed more than 2,500 surgeries here at Fairfield Medical Center, and innovative with this new technique, and we appreciate not only you stopping by to tell us about it today, but your willingness to bring that to Fairfield Medical Center and to the Lancaster-Fairfield County community. Dr. Numberto, thank you so very much.
Thank you for the trust.
If you have questions, you can call here at Fairfield Medical Center. The phone number is 689-6893, and they'll be happy to fill you in on everything that's going on here in cardiac care at Fairfield Medical Center. We're going to take a quick break. When we come back, we're going to be talking about another cardiac-centered program designed to help our community, so don't go away.
Salad on Saturday, fruit on Friday, throw a ball Thursday. Water Wednesday, touch your toes Tuesday. Let's move Monday, swap us next Sunday. 60 minutes of physical activity a day and eating well can help get your child healthy. So keep them active and eating well every day. Get ideas, get involved, get going at letsmove.gov. That's letsmove.gov.
Welcome back to Fairfield Today. Kathy Bittler here with you from Fairfield Medical Center. Today we're in the cafeteria, and it's a pretty busy place. And it really gives me an opportunity to tell you, if you're visiting the hospital, seeing a patient here, and you get a little hungry, this is a good place to come. Jamie is a fantastic chef, and the food here at Fairfield Medical Center really is not your typical hospital food. It's really pretty good. So don't hesitate to come down to the cafeteria, pick up a sandwich or something while you're here. And a lot of the dishes that you will find here at Fairfield Medical Center are healthy dishes, as you would expect. And many of them are heart-healthy dishes, and we're talking about hearts and cardiac care today here at Fairfield Medical Center. My second guest is Misty Newsom. Misty is the Health and Wellness Services Manager here at Fairfield Medical, and she's been with us a couple of times before. Good to see you again, Misty.
Good to see you, Kathy.
You're busy.
We are. We are staying very busy.
That's
it's a good
great.
thing.
Remind our viewers a little bit about yourself and your background here at Fairfield Medical Center.
Okay. Well, I'm a registered nurse, and but I currently manage health and wellness services here at the hospital. So my job is to help develop programming for our employees, our businesses, and for the community.
Sounds simple. It's not at all. I mean, when you have how many employees here at Fairfield Medical?
About a little over 2,000.
So 2,000 employees, so we're dealing with specialized programs geared to them, things like what?
Things like our CHIP program, which stands for Coronary Health Improvement Program. We also have other programs that are supported by other departments within the center. Our Nutrition Services Department has a program called Healthy Way for Life, and it's also a very successful lifestyle management program, along with just general education, information for the community. Also, we provide services for businesses, wellness programming, screenings. We are always at a lot of health fairs. We are out in the community doing public speaking, and our latest and greatest thing is our Heart Safe Business Accreditation.
Which is too cool. Let me tell you, if you remember back a few months ago, we went to West Elementary, and we talked about West being the first school in the nation to be certified as a Heart Safe school. Well, as if that wasn't enough, now Fairfield County Lancaster has the first Heart Safe business in the nation, right?
Correct.
How did we get? You people at Fairfield Medical are just so innovative. This can't be a program that nobody else does. How did we get so ingrained here that we would focus on this and make it a priority?
Well, we about 350,000 sudden cardiac arrests occur each year, and unfortunately, some of those occur in the workplace, and I believe it's about 10,000 of those sudden cardiac arrests occur in the workplace. So, a lot of times we think it's only going to happen at home or at sporting events, but it does happen on the job site as well. And with the the Snyder Cardiovascular Institute and the Heart Watch Committee, we developed the Heart Safe Business program as well as to tag along with our Heart Safe School program, because we want our businesses also to be safe. That's one of the number one things that a business wants to provide is a safe work environment for their employees and also for their customers coming in. They want to make sure that they can respond to a medical emergency timely. And the more time that we can, or the sooner we can treat an individual, the better off they're going to be. It's because generally there's only a 5 to 7% survival rate when an arrest occurs after, outside of a hospital environment, and where there's delayed care for the person, the victim. So the sooner we can get that care started, the more people feel comfortable in delivering that care, the better off their coworker or their customer is going to be. So that's kind of the purpose, is to make our workplaces safer. Unfortunately, it does happen in communities. It happens in workplaces. And so we want to try to help prevent that, along with preventing the sudden cardiac arrest in students.
Absolutely. This really is a case where time is life. Minutes can translate into saving someone's life. And that's why all of this community training that Fairfield Medical Center has undertaken is so important. Now, you mentioned that the staff here developed the Heart Safe program. Is it in association with a state or national organization, or is this truly homegrown?
This one is truly homegrown. Our school is along with our SADS, the National SADS group. However, with the business, there really isn't a supporting organization for that we know of at this point. So it's truly Fairfield Medical Center's now at this point.
So the world is watching. So let's talk first about this business. I'm so excited.
Okay.
It's a business that's been in our community for years. It's a business familiar to people. Kumler Collision.
Yes, Kumler Collision was our first Heart Safe business. We were very honored that Dean Duroff, who is the owner and CEO of the company, was willing to be the pilot. We were trying to choose a smaller company, and maybe a company we'd worked with. They've also used our wellness services over the years, and so they were a good opportunity for us to use to try the program out and to see how things would flow, and to see if it was worth looking into for future businesses. And so Dean and his staff were phenomenal. They have a great plan. It didn't take them long to catch on. We went in, we do actually provide them with HOPE training, which is a type of resuscitation that does not require the breathing.
Yes, that's the hands-only CPR, right?
And so we provided them with that training, which is part of the accreditation. And then along with that, there's basically four criteria. And one of those is to train at least 25% of the staff on each shift in some form of CPR. Does not have to be through Fairfield Medical Center, but we just want documentation that their staff has been trained. Also, too, it requires them to provide a self-assessment for their employees, not for the business to keep or to manage their medical illnesses or conditions, but just so the employees know, hey, I may be at risk if I answered yes to one of these questions, and I need to see my family physician and let him or her know that I've had some of these symptoms. And then also we help them place their AEDs, their automatic external defibrillators, in appropriate places within their organizations, so that at any point in a building, someone could get to the AED and back to the scene within a 3-minute time frame, because the best opportunity for someone to survive a sudden cardiac event is to receive that defibrillation, that shock, within 3 minutes. So that's why we want to place those AEDs in appropriate places within an organization. And so we help them determine how many AEDs they need on site, and then also to where to place them, education on how to use them along with the CPR training if need be. And then we also make sure that they have emergency drills set up. And we will actually go out and provide the emergency drill, help them with those. But the organization has to commit to doing at least one medical emergency drill a quarter, and so and document those. And so that just keeps their employees more focused, maybe more comfortable to respond.
And it's like any other skill. If you don't practice it, you lose it, you forget. And especially when we're talking about a heart attack, and you know it's someone's life, the more comfortable you are with the procedure, the less likely you are to panic. And that panic can cost important time.
Exactly. And little things like maybe they call 911, but then no one's out at the front of the building to help direct the appropriate personnel where to go once they get inside the building, or maybe it's a multi-building facility. So just little things can cost a lot of time, and so making sure we have all of those ducks in a row, per se, to make sure that we can make the best emergency drill. You know, we make sure we simulate it to the best of our ability to be a real situation, so that the staff can feel comfortable. Another great thing is with the AEDs, the new ones actually are really self-explanatory.
I have to tell you, we just got a bunch of these at South Central Power, and they are phenomenal.
Yeah.
You can't do them wrong. You can't use them incorrectly.
No.
And it really is pretty much a, okay, go kind of deal.
Yeah.
It's tremendous.
You open it up, it starts recording immediately. You put the pads on, the pads are already in place. You don't even have to hook those up. They tell you exactly where to go. And the new pads, you don't even have to, the old ones told you this one goes here and this one goes there. Now it doesn't matter which one you put, as long as you put them in the right places. And you don't even have to hit the shock button, because a lot of times people are afraid to hit that button
That's
when
a
it
scary
tells you to shock. It is a scary thing when you're not comfortable or not used to it. And so now it just automatically shocks on its own if it's indicated, which definitely saves a lot of people's lives and helps that person feel confident that they're doing the right thing. And so we want them to feel comfortable when they're using these machines.
So this was with Kumler Collision, the first one, kind of the trial.
They were.
Did you learn anything? Make any changes along the way?
Just not a lot of changes. What we did learn was that people are very interested, and they want to do things right. They want their workplace to be safe. They care about each other. They care about their community and the customers that are coming into their building. They were very interested in learning and very excited, and we really appreciated that. But no, pretty much, we made a few tweaks verbiage-wise to the booklet, because what we have developed now is an actual packet or a binder of information for a business. And when we're out and about at different business locations or different health fairs, we will have information on how to sign up to become a HeartSafe business, and then basically you turn that information back in, that sheet back in, and then we will send you a booklet. We can come out and help the business. We're more than happy to do that, or we can let the business do their own, do it on their own, and then just call us when they need us for an emergency drill.
Now, have other businesses stepped forard and said, "Yeah, we're ready. Come help us,"
including South Central Power.
That was a planted question, of
yes,
course.
But we do have, I believe we have at least, that I can think of right now off the top of my head, 4 or 5 businesses who
That's
are in
tremendous.
line. Matter of fact, I just met today to finalize the rest of the booklet so we can start getting those printed so that we can start going out to the rest of the businesses now and help them implement it. Because it is a good thing for a business to do, and to help keep their best asset safe.
Absolutely, absolutely. So you go through this 4-step process. You are accredited, but more than that, there has to be this feeling of peace that, God forbid, should this happen in your place of business, you're going to be able to handle it, and you might save someone's life.
Yeah, and the people we work with, we're with them several hours most days of the week. They become part of your family.
They really are.
And so to be able to help someone if they really need it is a great feeling for the rest of their coworkers. They don't feel helpless. They feel like they can actually make a difference.
Excellent point, yeah. I'm sure out there watching, we've got some folks who maybe serve on the health committee or the health and wellness committee at their place of business, and maybe they'd like to bring this on up the chain, take it to HR or the president or their director. So how do businesses that are interested contact Fairfield Medical Center? What's the application process like? How can we get more businesses on board?
Well, like I mentioned, we will have the intent to apply form available at health fairs and when we're out and about at different business opportunities. So those will be available. You can also call my office at 687-8137. We'd be happy to send that information out. You can call the main hospital number and just ask for HeartSafe Business or ask for me. Again, my name is Misty Newsom, or Health and Wellness Services. Hopefully they'll point you to the right direction and we can get that information out as well, that way as well.
We want to take this opportunity to thank Kumler Collision for caring so much about their employees and their patrons that they would even undertake this. And then to congratulate Dean DeRolf and his staff for this really tremendous achievement on their part, and to be the first in the nation. It's really exciting.
It is.
It
It's
really
very
is.
exciting.
Misty, thank you so much.
You're welcome.
Keep up
Thank
the
you
good
for
work.
having
Give
me.
us your phone number one more time, please.
687-8137.
Misty Newsom. So make sure if you have an interest in this HeartSafe business or HeartSafe school program, you give Misty a call. We'll get you on the list. We'll get you all the information you need so that you too can take the steps necessary that just might save somebody's life someday. That's all the time we have today at Fairfield Today here from Fairfield Medical Center. Thank you for joining us. We'll see you again next month.
Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, the Frankie Smith Funeral Home, and Lancaster Fairfield Community Action Recycling and Litter Prevention.
Here's your check. Oh, you got it. You know, since I got rid of my car, I really enjoy walking.
Okay. God, no.
Getting pulled over for buzz driving could cost you around $10,000 in fines, legal fees, and increased insurance rates.
Oh, you're home early. You live with your mom?
That'll set your game back a few years. Buzzed, busted, and broke. Because buzz driving is drunk driving.